Give me 1 second. So in the basic life support, we learned about the various aspects involved in the CPR, the cardiopulmonary station. So what exactly is a cardiopulmonary station and how we do it, and when we do it, all those things we learned. So yeah, you can see my screen now. We'll directly go to the part where we stopped. So we learned about three important things. One is about the triage. What exactly is a triage and when we do it. So categorization, three categories in triage. So then we learned about the priorities in first aid, the three P's, that is preserving, prevention of aggravation, promotion of recovery. And then we learned about how to do CPR. So when we do CPR, it's 30 compression followed by 2 rescue breathing and the rate of 100 per minute, 100 to 120 per minute. So we learned about the injuries management. That is three simple steps involved in the injury management. So basically, any injuries management requires three simple steps. That is direct pressure, elevation, and bandaging. So in this part, we'll continue again. There is something called internal abdominal injuries or closed abdominal injuries, or we can say it as internal bleeding. So internal bleeding, generally it is hard to diagnose, but it can be most commonly seen in any disasters or disaster related injuries like building collapse, train accident, bus accidents, or in any injuries. So how do you identify it as an internal injury? If it is an intra-abdominal injury, three things will be there. I always correlate any topic into three important issues to summarize and to remember also it will be easy for you. So in intra-abdominal injury, the three things is first thing is the person will be complaining of severe pain in the abdomen. He finds difficulty in breathing. Second, when you touch that portion, it will be rigid. Normally, the tonicity of the abdominal wall will be soft, it will be rigid. The third thing, whenever he breathes or coughs, also the pain increases. That indicates there is an organ inside the abdomen which is ruptured due to the injury. So he need to be operated within 1 hour. That is golden 1 hour. So the golden 1 hour applies to the particularly for the closed abdominal wounds only. Remember this part. And closed injuries or internal injuries are more important to diagnose. If you identify it as an internal injury, you saved his life. You don't have to do any first aid. You just identify and make sure that he is shifted to the hospital as early as possible. Reason is, so surgically, present day medical technologies, present day hospital systems and hospital facilities able to manage such kind of injuries. Earlier days, probably 20, 30 years before, any such injuries, the closed abdominal injury, it was hard to diagnose, and most of the time the person will not survive in that incident. Now it is not like that. So don't hesitate to shift. Most of the road accident or building collapse cases, the people may not immediately shifting such person who is unconscious and internally injured, thinking that he is already dead. For any case, don't take a judgment, don't take a decision that he is dead. Check for ABC, check for other vital signs, and if you find any symptoms, any signs that he may be alive, immediately try to it shift to him to the hospital. Okay. Then comes a head injury. So generally there is an understanding among the people that head injury people, the injured person will not be surviving in that incident. No, it is again a myth. As I said already, the present day medical technology and the system the hospitals have, definitely a person with a head injury can be saved. So how do you identify, how do you recognize a case of a head injury? So generally in case of a head injury, there may be bleeding from the nose and it will not be profuse bleeding. In case of a direct injury to nose, the bleeding will be very profuse. It is hard to diagnose. Okay, but here it will be very less. The bleeding will be, it's we call it as a nasal discharge mixed with the cerebrospinal fluid. The person may be conscious, or person may be unconscious also. In such case also, do not hesitate to shift him. Don't give him water. Both the cases, either abdominal injury or head injury, don't give water. So if you are giving water, so definitely you are aggravating that condition, and that can result into further aggravation, and it is difficult for the medical team to give anesthesia if you have given water. So please don't give water in such conditions of internal abdominal injury and head injury. Okay. Then comes the next part, that is so while shifting, make sure that the person should be in a semi recline. Semi recline means to say, as shown in the diagram here, semi recline posture, not completely flat, not completely upright, semi reclined posture. Okay. So the ambulance, generally if you call ambulance, they know this, how to shift a person with abdominal injury, a person with a head injury. But if they are unaware, most of the time some of the paramedic staff or some of the ambulance will come with a driver only, he may not be trained properly. So definitely, if you are there, you can definitely guide them. And then comes a fracture. So fracture means to say, this generally can happen in train accident, bus accident, or any cases of building collapse also. So fracture means to say any discontinuity in the bone. So fracture can be seen outside, that is we call it as open fracture, and sometimes it will be in the form of a swelling, that is closed fracture. So open fracture and closed fractures are the two things to be remembered. And so generally, how do I recognize as a fracture? There are other conditions such as sprain and strain, twisting of muscle, ligament tear. So how to differentiate between a fracture and a ligament tear is, fracture, generally there will be discontinuity of the bone. Person will be having a severe pain, swelling, followed by the loss of movement. The loss of movement is a common sign and symptom of a fracture. The person will be unable to lift his hand. So if you see such signs of after an injury, the first thing what we do is to immobilize and stabilize. Okay. For immobilizing, we can use any splint. Any wooden splint can be used, or any probably you can use a stick, or you can use a scale, or anything rigid can be used, and stay immobilizing it by a sling. Okay. So sling is applied, basically splint is applied. So two things to be remembered in case of a fracture. Okay. So we commonly use a triangular bandage. This is triangular bandage. It is commonly nowadays available in the first aid kit also. So triangular bandage is one type of a bandage that can be generally used for any such purpose. So use triangular bandage in such situation to stabilize. And there are some injuries in the disaster which results into spinal cord injury also. So spinal injury again is a very sensitive injuries which can result into paraplegia or quadriplegia. Paraplegia means to say loss of movement of both the leg. Quadriplegia means both the hand, leg, and the pelvic portion also will be losing the control. So I'm using technical terms on the medical terms in between. Probably you may find it bit difficult to follow, but please try to understand. Any spinal cord injury results into paralysis, stroke kind of a loss of movement. So basically, how do you suspect a spinal cord injury after an accident, after a disaster? So the person will be unable to move his leg and hand portion. So that indicates spinal cord injury. If you suspect spinal cord injury, till the ambulance arrives to the scene, the neck should be supported. Remember to support the neck. Neck should be held properly like this. Neck should be supported. So we need to have a neck collar. If you don't have an access to neck collar, you just support the neck continuously. So that can be done. Neck can be continuously supported, and it can be held like that to prevent further movement. So we need particularly, how to recognize spinal cord injury. This is a common question that is asked. It's very simple to recognize spinal cord injury. First thing, if the person is conscious, he will be unable to move his hand and leg portion. He will be unable to stand up, unable to sit down. He will be there in the site of the accident as it is. So there will not be any injuries related to respiratory system or circulatory system or the central nervous system. So person will be able to talk and able to interact with you, but he will be unable to move. So in such a case, the neck should be stabilized first, and cushion should be provided to place wherever you can see the hollow in the spinal cord, near the neck, near the lower back. So this is the posture when you suspect a spinal cord injury. Before we shift the casualty, this is the posture. Neck should be properly held and supported, and we need a spine board also. So this is spine board. You can see the spine board. So spine board is required to shift a spinal cord injury related patients. So remember this, because it is very important that if you are shifting a person with a spinal cord injury, you cannot use a stretcher, you cannot use any other method, we cannot use uh, holding him by hand and leg. That is wrong. Okay, so remember, that is proper stabilization is required, proper support is required. So proper stabilization and support is can be given using a triangular bandage only. So triangular bandage generally is generally you can see the triangular bandage to make a C collar and a spine board to support, and you can use a cushioning material as a cloth material also. So that is generally can be used. uh, okay, you can see here for the proper stabilization. All right. So we just saw how to manage a case of injured or any injuries in any situation. So you can use locally available equipments. You can use locally available materials to do this. Sometimes if you don't have access to standard equipment also, we can convert locally available equipment. Like for example, a book can you can use a two pole to make a stretcher also. So there are various method of transportation. So in any disaster, the first priority is ABC, triage. The next priority is management of the wound. In the management of wound, stopping bleeding, then supporting the fracture, and in case of a spinal cord, suspected spinal cord injury cases, shifting him properly. Okay. So when it comes to shifting any casualty with any other injury during a disaster, for example, train accident. In case of a train accident, probably you may get a 10 or 15 stretchers, but in a train there will be thousands of people. It is impossible to use stretcher for every case. You can prepare stretcher, you can convert your hand into stretcher also. In this part we are discussing how to make different transportation methods. So these transportation methods or different transportation methods are used in case of when there is no standard equipments are available. If you have an access to standard equipment, that can be used. If there are no standard equipment available, definitely these materials can be used. So what are these materials? Let's have a look. So this is a type of a method, manual lifting method, which the fire department generally practices. It's called fireman lift, when only one person is there who can enter inside the a fiery smoky chamber with a proper protective gear. So fireman lift is practiced, pick a back method is practiced, crutch, human crutch method or human cradle method is practiced. That is only when one person is available. Okay, so fireman lift needs a bit of a practice, and it's a very easy method to carry one person on your shoulders. Okay, right. Then when two people are available, we can use fore and aft method. Fore and aft means to say one person will be standing behind the casualty and locking the particularly at the armpit region, and the second person will be holding the leg. That is these methods of transportation can be adopted only when there is no access to the stretcher, only when there is no spinal injury. Spinal injury cases, you have to use a spine board only. Okay, all right. Then you can see this is again fore and aft method when two people are there, and this is practiced in case of armed conflict, armed arm related injuries, warfare. During such situation, also fireman lift and fore and aft method is commonly used, because there will not be access to stretcher. There will be only uh, A few people will be there to shift. So fireman lift is most frequently practiced, and this is indicated for injuries such as abdominal injury and chest injury, bullet injuries. This method can be used. There is one more method called human chair. I'll show that method also, which is easy and more convenient to do in case of such injuries. So this diagram you can see here, which is wrong. This is totally a wrong method of casualty handling or transportation of injured. This is after a bomb blast. You can see that after a bomb blast, a casualty is been shifted using hand and leg push. So holding the casualty or an injured person by hand and leg is wrong. And if you're doing that, we are going to aggravate that injury. So please don't do that. Okay. The correct method is this method. We call it as a human stretcher or a three-man method. In the three-man method, what exactly we do is all the three people will be standing down with a one knee down position, extending the hand, supporting the neck, back, and the lower back and the leg portion. So this is most convenient method. We don't need a stretcher, we don't need a standard equipment. So we need only three people to do it. It's very simple. We do practice. We do actually demonstrate and practice this technique during our training sessions. This is again from one of our training. I was a resource person for the ANF also, anti-Naxal police force. So we train them regarding casualty handling when there is no stretcher available when they are working in jungle. So this is very easy and convenient technique to do it, where you can hold the casualty in the hand extended. So first step is this: taking the casualty to your hand with a knee down posture. When they stand up, the second posture will be like this. So there is one more method. So very important. Please don't ignore the casualty handling. See, generally we educate people regarding CPR, basic life support, injury management, but we don't train them regarding how to transport an injured. In any disaster, there will be hundreds of injured. So all professionals will not be handling any situation. Means to say, for every case, there will not be a professional to support it. So we need a common man, a layman, a bystander to help him to shift the casualty, to guide them properly using the hand method, forehand method. This is a very easy method which everyone knows. We can convert that into human chair in case of any injury related to abdomen, chest, or the leg portion where a person will be unable to move. We can use this technique. It's called forehand method. Okay. The chair also can be used as a stretcher, make the person to sit on the chair and can be shifted also. So this is again a little bit modified fore and aft technique, where you can see clearly, though in the fore and aft technique we used the other method. This is slightly modified method of two people holding a casualty. Okay, there's one more technique. This is very simple, which everyone know. Like if you have an access to blanket or a tarpaulin sheet, if you have an access to carpet, mat, so we can use that, convert that into a stretcher. If you remember the Odisha triple train tragedy where three accidents happened, there we didn't had the response team didn't had the stretchers. Proper stretcher was only few number, 30 number. So what they did is they used the blanket inside the train. The train was equipped with a sleeper coach where the blankets or shawl was there. That was converted into stretcher with this method. We call it as roll method. Don't hold the end part of it. The corners should be avoided. Roll it. So make sure that it is extending. The width should be extended only to the width of the casualty. Okay. So we'll be supporting it. This is called blanket stretcher. The blanket stretcher will be definitely easy method, one of the simple method, uh, simple and easy method. Simple and easy method to shift the casualty. So we call it as a blanket stretcher. Remember, the blanket stretcher again is one of the method practiced in our armed forces. It's a very easy technique. We don't require any special equipment to do this, but very simple as well. uh, Loading the casualty, this can be used to load the ambulance or load the stretcher as well. Okay, so so far what we discussed now is about stretcher casualty handling. It's again an important topic. Remember, just by putting a bandage, just by putting a sling or a stabilizing with a splint, we do not complete our work. In first response, we have to shift him properly also. The objective of first aid is three: preserving, promoting recovery, prevention of aggravation, and providing safe transportation. So remember that the objective will be complete when we do it completely. So we need to support in the all the phases, not only in just providing support during injuries only. Okay. So next is important topic is drowning when it comes to disaster. So drowning is the commonest thing. Drowning requires three things. One is rescuing from water. Second is removing the water from the body. The third is very important is providing first aid or basic life support. So we will learn in this topic how to help a person who is drowned in the water, how to remove him from the water, how to rescue him from water. Again, this topic requires technical training, means to say practical training. So it is only for your sensitization, but definitely I advise those who are interested to be the part of the disaster response need to undergo a practical training regarding these aspects. Okay, first is drowning. So what is drowning? Drowning means to say the most common drowning in the water, and these cases nowadays is increasing. And most of the college students, the victims of the drowning are the college students, are the youth aged between 15 to 25. So why drowning cases are increasing and when it is happening? So most of the drowning cases are reported during summer or winter, not during rainy season. Why summer? Because during the summer vacation, the youth will go for picnic, will go to a place where there is a water. They enter in the water without proper safety. Some of them may not be knowing proper swimming. When one person starts to drown in water, the other people will go to rescue him. They will also get drowned. So the commonest reason for the drowning is nowadays is lack of safety, improper learning of swimming. They may not be aware about proper swimming, and most of these water bodies they have removed. They have not removed the silt. The silt means to say the mud. The mud inside, when they get trapped inside the mud, it will be difficult for them to swim. So the mud, when it is removed, the silt, if it is not removed, if it is there on a lot of desilting, if it is if it is removed also, there will be swill formation. So that again makes them prone for the drowning in water. So when it comes to rescuing from water, please do remember, never enter the water directly without any proper safety device. So when somebody enters into a water, the best method is non-contact rescue, not the contact rescue. So what is non-contact rescue? Using stick, using a rope, using a cloth to rescue. Non-contact. Never enter into the water. If someone enters into water, he needs to be protecting himself with a life jacket. Otherwise, he may also be a victim. Every day weekend newspaper, means to say the weekend incident that is reported in Karnataka or in any other states is drowning. The people in the weekend, they go for a picnic, they go to the tourist place where there is a water, they enter into the water, they take the selfie photos there. They take a lot of risk of taking the photograph, a good photograph near the water. They end up drowning in water, and so that results not only drowning and death of one person, it will be two or three people. You may have heard about such incident, read about such incidents in the newspaper also. So please do sensitize your students regarding prevention of drowning. Ask them never enter into a unknown water without taking proper safety. If they are entering water, the life jacket can be kept ready. Life jacket can be prepared using locally available materials. There are very simple materials that can be converted into a life jacket also. So remember, non-contact rescue. Non-contact means to say using rope or using cloth or using any other type. So then even a board also can be used. Wooden board or a plastic board can be used for non-contact. So when we are doing contact rescue, life jacket is a must. Okay, so remember, when we do a contact rescue, when we enter inside the water, so life jacket is a must. And always the approach is from behind. Don't approach if the person is conscious during a drowning. If you approach from the front side, you also may get end up with drowning, because the person who is already drowned, he may try to catch you, hold you tightly, which will make you unable to swim. Okay, there are simple method that can be used, that can be converted into life jacket. There are simple techniques are there to convert into a life jacket, to prepare a life jacket. The commonest method, that is using plastic bottles or using plastic cans. So plastic bottles or can be used to prepare a floater device that can be used during any such flood or any such related incident. So common thing is, you can see the floater device here. Even a water bottle also can be used. So water bottle can be commonly used to convert into a life jacket. Okay, so how to make it as a life jacket? Simple thing to remember: tightly close the bottle, empty bottle, seal it with a adhesive tape. It should be tied in the reverse direction. So if you tie it 4 or 5 bottles in a serial, and if you tie it around the chest and around the shoulders, so it will be easy for you to shape, easy for to wear it, and it acts like a life jacket. Okay. uh, okay, this is again one of the technique that's shown here using life jacket. There are very simple techniques of using life jackets. Okay, so when we the approach is from behind, if it is a contact rescue, as I mentioned, the approach is from behind. And if you can see that the casualty is placed in a recovery position. So what is recovery position? Recovery position means to say which will help the person to breathe easily without any proper much of difficulty. And how to drain the water? So generally what we do is, when we are supposed to drain the water, we used to apply the pressure force on the abdomen. That is wrong. Applying force on the abdomen will drain only the water from the abdomen. We need to drain the water from the lung. How do we need to drain it? Placing the person in the face down posture, supporting his hand, and applying pressure to the shoulder blades. Okay, so that is how we drain the water. If you suspect a person has swallowed the water, then the first aid is same what we learned in the first session, that is CPR, cardiopulmonary station. So cardiopulmonary station means to say, we compress at the center of the chest at the rate of 100 to 120 per minute. For every 30 compression, we give 2 mouth to mouth breathing. So that method is practiced. Then we do CPR, mouth to mouth breathing, till he reaches to the hospital or till the ambulance arrives. Okay, there are many other equipment that can be used as life-saving devices in case of any emergencies. Here in the picture, you can see that there are dried coconut and peeled coconuts are there. Then water bottle is there, water can is there. So all this can be converted into floaty device. So what you are seeing in the picture need to be tied in a series, that should be tied around the body properly. So that will easy for a person to float. It will make a person easy for floating in the water. Okay, that is, that's a improvised life jacket. We using locally available material we can use. This is again from one of our training in Odisha. And this training was like where common plastic bottles were used to convert that into a life jacket. We made them to prepare the life jacket, and using the life jacket, the standard life jacket is at the center, and you can see on the other side there is the life jacket which is prepared using the locally available material. Okay, so what is the next thing to be remembered is fire. So the common thing among the disaster is water is first, second is fire, the road accident is very common. So these are the three threat which we are living with. The one more threat is the health related emergency, that is the heart attack and the cardiac arrest. So the the next topic which we are going to discuss now is about the burn injuries and the management of burn injuries and management of fire related accidents. So when it comes to the fire related accidents, please do remember, fire is a chemical reaction, as you know, and your college, any building is equipped with a fire extinguisher, and every one of you should know how to operate the fire extinguisher in case of emergency. So the person who is trained may not be available. If you make aware at least 10% of the people, the occupants of the building, how to operate the fire extinguisher, that will be great use in case of any such fire accidents. So how to use the fire extinguisher, what are the different types? I will not be going into the detailed aspect because this is part of a topic that need to be covered under um, the rescue, not in the first aid, but still you need to have a basic knowledge regarding this. So how to use a standard fire extinguisher? So fire extinguishers are available in different type. The standard the one is ABC type, which is available at your college. So commonly these type of fire extinguishers is operated with a pass method. So what is pass method? Pass method means to say PASS pass. Remember the pass. Pass means to say this is operated using the same concept and the mechanism. P means to say pull the pin. So once we pull the pin, then we aim at the base of the fire, then we squeeze the trigger and sweep it from side to side. So remember pass method, pull the pin, aim at the base of the wire, squeeze the trigger and sweep it side to side. So this pass method is commonly used method for any type of fire extinguisher. So fire extinguisher generally are available A type, B type, C type and D type is there. ABC is the common one, which can be used for any fire. It contains a DCP, that is dry chemical powder. A type means which is used for solid fire. Solid fire means fire originating from wood or cloth or any solid made paper. You can use A type of fire extinguisher. B type means to say the fire originating from liquid, like combustible liquid, like fuel, oil, or petrol, diesel, kerosene fire. You can use B type fire extinguisher. C type of fire extinguisher means to say LPG, methane, gaseous fire. We can control using C type of fire extinguisher. So ABC can be used for any type. And in case of fire, the points to be remembered in case of fire is the occupant of the building should evacuate immediately, first thing. And when they are evacuating, remember not to use the lift, only staircase. And when they are running out from a smoky chamber, the best method that can be adopted for escaping from a smoky chamber is drop down and drop down and we'll be using our hand and the knee portion to crawl outside, because smoke will be lighter than the air, it will be at a higher level. If you try to walk and run, the person may collapse there because of suffocation. The best thing is covering the nose with a handkerchief and try to crawl outside. So this is a picture from Colter Tower fire tragedy that happened at Bangalore, killing 10 people. In this incident, there was a fire tragedy, fire accident that was reported in the afternoon. So in a multi-story building, and the occupants of the ninth floor didn't know how to escape from that fire. The whole building was filled with the smoke, not with the fire. And occupant of the ninth floor, they jumped, they broke the windows because it was a centralized air conditioned building. They broke the windows and they jumped from the eighth floor. They waited for help for few minutes. Then they jumped from eighth floor, and all of them they died due to the head injury. This incident, if you remember, way back reported in 2012. And there are such many incidents reported all across the nation, like where people jumping out from high-rise building. So it is very dangerous, very risky, and definitely that can result into death only. So the best thing is crawling. Crawling is the best method to rescue from the smoke. All right. Okay. So for the burn injuries, the first aid for the burn injuries is water, water, and water. So water should be applied for 10 to 15 minutes till the burning sensation subsides. Generally, there is a myth, there is a misunderstanding that the water will cause a blisters. Blisters will form after any burn injury due to the heat, not due to the water. So the blister what is formed should not be opened, should not be bursted. So usually what the people will do, they just burst open the blisters. So blisters should not be open. In case of burn injuries, if a person is wearing ornament or bangles or ring need to be taken out immediately. Reason is there will be a swelling accompanied with a burnt wound, and there will be a constriction caused by these ornaments also, resulting into injuries. So it is difficult to remove later. It is best thing to remove it immediately. And if a person, the whole clothing is under fire, so please don't try to run in panic. So the best thing is drop, cover, roll, and stop, drop, cover, and roll. So please remember this technique. This why this technique? It's a very simple method. Drop and roll method is the very simple technique to control the fire when somebody's clothing is on the fire. Never try to run in panic. If you run in panic, the fire will get more severe. Okay. All right. And don't try to remove the clothing which is stick to the burnt wound. You have to cut it open. If you remove it directly, the whole skin will come out. The skin portion which is burnt will come out. And don't try to open the blisters. Right. So generally people will tend to drain the blisters, and if you do that, that results into draining of plasma. It contains a plasma inside, and the plasma, once it is drained, that will result into an infection, and that will result into a permanent burn mark also. Then remember water. For how long you are supposed to put the water for the first water for the burnt injury? It's 10 to 15 minutes, or till the burning sensation subsides. If it is an acid burn or alkali burn, we do put water for 30 minutes. So we do put water for the 30 minutes if it is a alkali burn, or if it is a burn which is related to acid. If it is a regular dry flame burn or a moist burn due to hot water, so that will be 10 minutes underwater. Okay, do not apply any ointment, cream, or oil, or anything like that. Even a burnol or any anti-burn cream in the first 1 hour is not recommended, for the very reason that it is oily. When you apply it over the burnt wound, that can cause attract the dust particle, resulting into infection of the wound. Okay. Next is they have covered the burnt wound with a plastic cover. For this we do it to prevent the dust falling on the wound. So for minor burns, 10 to 15 minutes of water. For the major burns, don't put the water directly on the body. Okay. If there is a major burn, more than 30 to 40% or 50% is burnt, don't try to put the water directly on the body. If you put water directly on the body, that can cause a shock. Okay. The person may go for a shock also. And very important is, and if a person goes for unconsciousness after any burn injury or drowning, or after any sorts of injury, if the person is unconscious but you have checked his breathing, he was breathing, so at that time, if he was breathing, we turn the casualty towards a recovery position. Recovery position means to say it is a posture which will help the person to breathe easily. So recovery position helps the person to breathe very easily, and this position is most convenient for the chest muscle to be in a relaxed state. And if a person is vomiting, also the vomiters will not go inside. Okay. So, how to turn the casualty into recovery position? Four simple steps to be followed. First is the first step is uh, the arm which is closest to you. We need to place it in a right angle. The other side of the arm will be placed in the other side. So remember, not like this. So it should be like this, and gradually turn the casualty towards your side. So we turn the casualty slowly towards your side and placed on the one side. It's also called in the medical term as the left lateral position. So it is not left. You can place it on the right also. Okay. So for any person who is unconscious and not breathing, the simple technique is turn the casualty towards your side. So turning the casualty towards your side, it's easy, and it will help the person to, how long you're supposed to keep him in that posture? Till the ambulance arrives. So till the ambulance arrives, the person need to be kept in that posture only. Okay. Then for the heart attack, no, so we briefly discussed about the CPR. And just let us briefly discuss about the heart attack. Even though I do agree that this is not a disaster related first aid, but it's one of the important thing to be remembered in case of any disaster. Also, there may be hundreds of people who are working are affected. They may end up with a heart attack. So how to manage a heart attack? It's becoming one of the major cause of death in India, heart attack, and the statistics says that it is increased. It is tripled in the last 3 years. It has increased by three times. The statistics of 21, 22, and 22, 23, if you check, and if you check the statistics of 24, 25, as per the Ministry of Health, the number of people affected with the non-communicable diseases like the non-communicable disease related to hypertension, diabetes, and other non-communicable disease, common one will be heart attack. So what are the symptoms and how do we manage? So this we are going to discuss now. So please do understand the difference between a heart attack and a cardiac arrest. Heart attack is caused due to the blockage of arteries which connects to the heart. Okay, the artery which connects to the heart, if there is a partial and the total blockage, it can cause a heart to stop. Right. So there will be symptoms of heart attack. Heart attack will not be a sudden. It will be giving you the warning sign. The sign will be a chest pain only. So the in case of a heart attack, or we call it as MI, myocardial infarction. In case of acute myocardial infarction, the warning signs and the symptoms will be five. Remember five. At least three will be there commonly. Severe throbbing pain. Throbbing means to say throbbing, heaviness you felt at the center of the chest. Second, difficulty in breathing. Difficulty in breathing is the commonest sign of any heart attack. Okay. So the third, the person will be sweating profusely. We call it as a cold sweat. If you touch the hand and feet portion, it will be cold, but person will be sweating. So the third will be sweating. The fourth will be nausea and vomiting. Nausea, vomiting means vomiting sensation, or vomit also may happen. The fifth symptom of a heart attack is giddiness. Giddiness means you feel like the disoriented. Okay, the person may lose his balance also. So common, you can see three symptoms: severe tightening of the chest, pain in the chest. Okay, there is a difference between acidity, hyperacidity, gastric irritation, and the chest pain related to the heart attack. So how to differentiate? Chest pain related to heart attack will aggravate with the moment. If you take one or two steps, if you walk, if you climb stairs, it will get aggravated. But acidity will not get aggravated even if you move, even if you jump, even if you walk also. It will be spontaneous and it will be repeated. Acidity will be continuous sometimes. Okay, so in case of a heart attack, the signs, if you see such signs in a person, make him to rest down, means to say not lying flat. Don't make him to lie down flat. Don't make him to sleep. So make him to in a resting posture. Remember the English letter J, J posture. We call it as L posture or J posture. Remember the word J. Semi-reclined, as shown in the picture here. It will be easy for the person to breathe. A person with a heart attack will be conscious, and ask him to take a deep breath. Okay. So generally what we ask him to do is take a deep breath. That will help in tissue oxygenation. Monitor his ABC, airway, breathing, and circulation. Call for an ambulance. If you don't have an access to ambulance immediately, arrange for a vehicle, but don't try to make him walk. You have to shift him in the sitting posture only. You have to use either a wheelchair or a chair which is available at the office, or chair which may be available at your home. Make him to sit on the chair. You need a help of a two people to lift the chair towards your vehicle. Okay, don't make him to walk. Why the number of death cases in heart attack is increasing in India? Because our common man doesn't know the first aid, the basic simple first aid related to heart attack. You may have heard in Hassan district in Karnataka, where every day 4 or 5 heart attack cases was reported. So it is not only in Hassan district, it's in every district. So reporting is less now. If you start reporting only on heart attack, you will see hundreds of heart attack in a one day. So if the media start focusing on heart attack, They are not focusing it on heart attack. Only in particular district they started, the media attention started increasing there, it was reported. But it doesn't mean that the cases are not high. Cases are very high. Why people are dying in heart attack? You may have noticed young people dying due to the heart attack, aged between 30 to 40. Why young people? There are so many issues related to that. Basic common issue can be a lifestyle related, or common issue can be genetic, common issue can be related to pre-existing conditions, or common issues can be related to post-COVID related changes in our body. So, what is this post-COVID related changes in a body? This is the concept which is not accepted by ICMR, Indian Council for Medical Research, not accepted by Government of India or Government of Karnataka, but it has been accepted by more than 8 countries across the world, saying that the COVID has changed many things in our body. It is not the vaccine, it's not the disease, it's not the COVID medicine, but post-COVID, the changes in the body has made us more prone for heart attack, more prone for bleeding, more prone for the clotting. So this is a very lengthy topic to go into heart attack. But please do remember, these are preventable deaths. It can be reduced and prevented. Immediate attention need to be given. It's a medical emergency. Do not, if someone collapses with a chest pain at your college, at your building, at your workplace, do not hesitate to provide the first aid. What is first aid? Not the CPR. CPR is indicated when a person goes for unconsciousness and stops breathing. Okay, don't give the CPR for a person who is conscious, who is breathing. Cardiac arrest, definitely you have to start with the CPR along with the AED machine. What is cardiac arrest? Cardiac arrest is a sudden stopping of the electrical supply to the heart. When it will happen? This will happen in case of any emergencies related to the heart. There are aggravating factors. What are the aggravating factor? Like cold weather. Nowadays winter started, so please do avoid walking in the early mornings. Early morning walking is very dangerous. So your doctor has advised you walking, they never asked you to do early morning walking. Why early morning walking is not advised? Because your heart is not ready to pump so much of oxygen and blood to the organs. If you suddenly started walking and running, your heart is not ready, because under the cold temperature, the heart is also slowly functioning. That exerts too much of force on the heart, resulting into heart attack. So the one of the precipitating factor for a heart attack is early morning walking during a winter, cold weather. Second, smoking. Third, stress. The third factor can be a stress, can be inducing factor for a heart attack or a cardiac arrest. Okay. So anyway, this is a very lengthy topic to be discussed, but under the scope of the disaster management, only these things I can say is support him, help him, provide him first aid, and help him to shift him to the hospital as early as possible. Okay. So remember what all the things to be done or not to be done. So what are the things to be done is posture. Place him in a resting posture, supported to the wall. Ask him to knee down, means to say sit down on the floor only. Even on the chair is also for okay with the semi reclined, leg extended. Remember, leg extended. Extended leg posture is not possible on the chair. Okay, why leg extended? It will provide more oxygenation to the heart and the brain. That's why the leg extended. Then don't give him water. So the commonest thing what we mistake in case of any such emergencies is we tend to give him them water. For any emergency for that matter, we tend to give them water. So water is of no use in that situation. You are aggravating it. Already he's finding difficulty in breathing and you are giving him water that can choke, right? So you don't give him water. Then next thing, ask him to breathe deeply, right? Deep breathing, taking a deep breath will help. And you can give an aspirin tablet if you have an access to the aspirin tablet, at home or at office or in the first aid kit. Aspirin is a safe tablet. Suppose if it is not a case of a heart attack, accidentally you gave an aspirin tablet, nothing will happen, don't worry. It's an acetyl salicylic acid, it is equal to a painkiller, but the advantage of this tablet is it's having an antiplatelet activity, and it prevents the clot formation inside the blood vessels in the heart. It opens the clot. So ask the person to chew the aspirin, not to swallow. Swallow mixed with a digestive enzyme, it will be absorbed to the circulation slowly. When you chew, it will be absorbed to the lymphatic supply below the tongue, and that can absorb, that can act very fast. Okay, so remember, it's a very lengthy topic when we take up heart attack, but this much is are the very important points to be remembered in case of a heart attack. Okay, all right, we'll go to the next topic, that is snake bite. In any disaster post flood, snakes are commonly seen around the house or sometimes inside the house also. So flooding may bring in different type of aquatic animals, including snake, or like you may have seen in during a floods in Gujarat, crocodiles have entered into the towns and villages. Crocodiles were seen at the rooftop. Snakes have entered into the water or inside the house also. So commonly the snake bite can happen, and number of death related to the snake bite in India is increasing, even though we have vaccine for this, we have medicine for this. People are not taking proper care, proper first aid is not given, proper vaccination, proper treatment is not given. That is again one of the reason for the increasing number of death related to snake bite. So how to how exactly to treat a case of a snake bite? So how exactly to do the first aid? We'll go step by step related to snake bite. First, let us understand how to differentiate between a venomous snake and a non-venomous snake. It is very important when you provide a first aid to have an understanding regarding venomous snake bite and non-venomous. We call it as poisonous and non-poisonous also. And please do understand, nearly 80% of snakes in India are non-poisonous. Okay, it is not poisonous. Nearly 80% of snakes in India are poisonous, non-poisonous. And how to differentiate the venomous and the non-venomous snake, and what are the important factors to be remembered here. So by looking at the snake also, we can make out whether it's venomous or non-venomous. Venomous means to say poisonous. So poisonous snake will be having a definite structure, and these are the common poisonous snakes in India. That's cobra, common crate, saw-scaled viper, and Russell viper. These are the common poisonous snake in India, and snakes have got a unique anatomical structure. If you look at the snakes, we can make out whether it's poisonous or non-poisonous. Generally, if you have a understanding, and we can at least closely identify whether it's venomous. So venomous poisonous snake will be having the following structure. The head portion will be broad compared to the body. Then eyes will be elliptical in case of a poisonous snake. And the third important is on the skin, you can see the markings on the skin will be very close. Then tail will be slowly tapered. So this is poisonous snake. So poisonous snake bite, if you see a poisonous snake, general appearance, head will be broader compared to body, eyes will be elliptical, and you can see the scales on the skin will be very close. When it comes to non-poisonous snake, the head and the body will be of same size, pupil will be rounded, and the pupil will be rounded, and very important is the tail will be slowly blunt. So seeing the bite mark also, you can identify whether it's a poisonous or a non-poisonous snake bite. So generally, uh, most of the poisonous snake bite will be having common signs of the bite mark. Two strong bite mark separated with a gap of 3 to 4 centimeter, and there will be color change around the skin, and there will be swelling. So if you see a color change, swelling, and two strong bite marks, you can suspect a poisonous snake bite. And if it is multiple marks which is very close, and if there is a bleeding, and if there is no color change seen, no other symptoms and signs except the bleeding from bite side, you can suspect it's as a non-venomous snake. But this is only for your knowledge and first aid. Don't make the person panic by telling him that it's a poison snake or a non-poison snake. Always assure him, reassure him repeatedly, say telling him that it's a non-poisonous snake, nothing will happen to him. Never try to make him panic by saying that it's a poisonous bite mark or it's a poisonous snake which has bitten him. Okay, don't make him panic first thing. And how much time do you have for the first aid and further treatment? First aid immediately, it comes under the golden 1 hour. And remember, first platinum 10 minute, the first 10 minutes is very crucial. So don't try to open the wound. There is a myth among the people regarding the snake bite. They tend to cut open. No need of cutting it open. So by removing the blood mixed with the poison, it is impossible to take out complete poison from the body. It has already entered into the circulatory system. So cutting the wound is not indicated then. So how much time it will take for symptoms to appear? Generally 5 to 15 minutes. The symptoms will start appearing depending upon the toxicity of the snake. So generally we have three type of snakes, that is hemotoxic, the second one is neurotoxic, the third one is called cytotoxic. The hemotoxic means to say where it will contaminate the blood and the blood related cells. The second one is cytotoxic, it will make the bitten part into gangrenous cell death. The third one is called neurotoxic, which will affect our central nervous system. Okay, so remember these three type: neurotoxic, cytotoxic, and the hemotoxic. What's the first aid? So first aid, the first thing is to reassure him and don't make him panic. Second, clean the wound thoroughly with the soap and water, right? Third is immobilize that portion. So you need to immobilize, clean the wound thoroughly with a soap and water. Immobilize that portion. How to immobilize that? The best thing to immobilize that using any cloth or a triangular bandage. So what we done here is to immobilize with a other leg. We have taken support of other leg and immobilized it. We are not actually putting a tourniquet. Don't tie, don't use any thread, rope, or metallic wire to put a tourniquet. So you can immobilize it using a cloth material only. Why to immobilize? So that the tissue absorption can be reduced and prevented. The reason for immobilizing is to prevent the tissue absorption, right? So the next thing is in that important thing to be remembered is when you immobilize it, uh, you always make note that the person is able to breathe, able to talk properly, and throughout the procedure try to interact with him, try to not make him panic. Okay, all right. So this is the first aid for the snake bite. Generally, we have lot of myth related to the snake bite. So we tend to cut, we tend to suck. So sucking of the wound is not indicated. Cutting of the wound is not indicated. Squeezing of the wound is also not indicated. So try to wash, clean the wound, and immobilize the wound. Shift him as early as possible. There is something called anti-snake venom, which you are very familiar with. ASV. ASV is commonly available in India. There are many types of ASVs available in some states, but in Karnataka we have only one monovalent ASVs. Means for all type of snake we have only one medicine in Karnataka, not two medicine. In Kerala they have different medicine. Why this is what it depends upon the probably the state government and the Ministry of Health to take a decision call on this issue and to procure it. But anyway, that's a technical part that will be taken care. But please do understand the first aid part of it. The first aid part is the very important is three. So remember all the topics which we have discussed here with the three important key points. The key points to be remembered with the snake bite. First, don't try to cut, don't try to put a knot, don't try to suck. Second, clean the wound thoroughly with the soap water. Okay, then immobilize that portion. Third, shift him as early as possible in a semi reclined posture, not in a supine posture, not in a sleeping posture, not in sleeping posture. It is semi-reclined posture. Why semi-reclined? Because the it may take more time for the poison to reach to the heart. So we have ample of time during that. So remember that. And anti-snake venom is available in nearest PHCs. Almost all the PHCs are equipped with the anti-snake venom. So if your college premises is located in a rural area, make sure that you have access to the nearest PHC. Find out where the nearest PHC is, and at the same time find out how many ASV they have, ampules they have. So very important thing about the ASV is it requires a continuous supply of power to store it in a particular temperature. So in a rural area, there may not be power supply for 6 hours or 12 hours. During that time, whatever the stored ASV will get spoiled. So it is the point to be remembered whenever you take to the nearest hospital, find out which is the nearest hospital where you can get a proper anti-snake venom drug. So this cannot be given for every patient of a snake bite. They have a protocol to follow at the government level. What they do exactly is they check for the protocol, means to say standard operating procedure. They check for the bleeding time, clotting time, and the prothrombin time, and based on that they start the ASV, anti-snake venom. So anti-snake venom is prepared using a snake poison only. Snake poison is injected to the horses. The antibody which is developed inside the horses will be used as a anti-snake venom. Okay, so remember this. You may be having a lot of question related to snake bite, but generally please do understand that snake bite death are preventable. Proper first aid is required, proper hospital care is required, and don't try to cut, don't make him panic, don't try to suck, don't try to put a tourniquet. Tourniquet means a tight clothing or a tight rope need to be avoided, because if you do that it will prevent it will stop the blood circulation to a particular affected portion, resulting into gangrenous cell death also. Okay, we'll go to the next part, that is the last part of the this first aid session. We covered almost all of the topic which is related to the disasters. We covered basically about the priorities, we covered basically about objectives, we covered about triage, then we covered about the basic life support, then we covered about injury management, then spinal injury management, then we covered about transportation of the injured. After that, we covered about the drowning, prevention of drowning. Then we covered fire-related injuries. Then we took about snake bite and how to manage snake bite. The last one is one of the medical condition that can be seen during a disaster site is fits and convulsion. So fits and convulsion can happen anywhere, and it requires a first aid. It may not be requiring a hospitalization, but definitely it requires a first aid. So what is a proper first aid for fits and convulsion? What is fits and convulsion, and how do we do exactly provide a first aid? That we are going to discuss now. Okay. So what is fits and convulsion, and how exactly we do first aid for fits and convulsion? So fits and convulsion, generally this fits and convulsion can happen during variation in the blood pressure, or for children during variation of the body temperature, during extreme high fever it can happen, or it can happen to a person who is having a disease called epilepsy, grand mal epilepsy and petit mal epilepsy. So it can happen to a person like pregnant ladies, it can happen due to variation in the blood pressure, the convulsions can happen. So what is convulsion exactly? Convulsion is nothing but a sudden surge of electrical impulses in the body. In the layman term we call it as a fits also. Okay, fits, convulsion, epilepsy, all are same. So how do we treat it? What is the first aid? So what will happen during fits? During fits, the whole body will not be under control. There will be complete shaking of the all over the body associated with the frothing coming out from the mouth. So what will happen in this condition? How long it will be there? So this condition will be there for few minutes. Okay. So during few minutes, it is a myth among the people that they give him a metallic object, they give them key bunches, key chain, or something like that. So giving a metallic object will not stop the convulsion. It is a myth. So convulsion will stop by itself in few minutes. So what should be done in that few minutes? First, make sure any hard objects are there, any sharp objects are there, move them away from the casualty. Okay. Second thing, if there are, if the person is about to fall, if you are standing next to him, hold him, make him rest on the floor. Third, don't try to stop the convulsion. Don't try to stop the convulsion. Don't try to hold him with a force. So many people do that. They hold him with a force, hold the hand and the leg portion. No, don't do it. If you are doing it, it ends up with a fracture. Okay. Then try to remove the frothing which is coming out from the mouth. There will be frothing coming out from the mouth. And there may be tongue bite also. To prevent the tongue bite, some people tend to put the handkerchief inside the mouth. Don't do it. Putting a handkerchief, putting a clothing, putting any cloth inside the mouth is not advised. If you're doing that, it will block the frothing which is coming out from the mouth. It needs to be cleared out. So tongue bite, let it happen. If the tongue bite is there, let the injury happen, we can treat it. But to protect the tongue, if you're putting anything inside the mouth, that can block the airway, that can choke the airway also. Okay. So please do remember that. Never try to put anything inside the mouth. Try to clear the frothing which is coming out from the mouth. And don't try to stop the convulsion. Make the area safe and clear, and loosen the tight clothing. Wait for the convulsion to stop. Wait for the convulsions to stop. And after the convulsions has stopped, turn him into recovery position. Right? So turn the casualty into the recovery position. So turning the casualty towards a recovery position will help him breathing. If he is vomiting also, the vomitus will go outside. It will not stay, or it will not get collected in near the throat. Okay. So don't give any metallic object in the hand. Giving a metallic object will not help. If you give also, nothing will happen. If you don't give also, the convulsion will stop. It is only a myth and a misunderstanding regarding the convulsion, that the convulsion or fits will stop because of the metallic object. No, nothing like that. It will stop by itself. If you don't give any metallic object also, it will stop. Okay. So please do remember that. And so this is about the convulsion, how exactly we are supposed to um, manage the convulsion. So usually during this session we used to extend up to 115 all the topic, but hardly few minutes was left for the discussion to happen. So that's why I'm stopping now, so that if you have any questions related to the various incidents, various topic that was covered under the first aid and emergency response, you please do ask any question. This is a time for the discussions now. So you can please do ask the question. You can either type the question, or you can directly ask the question also. So let me summarize before I conclude what we learned in the today's session. So today's session is focused on the important life-saving skills during any emergencies and disasters. So basically we learned about what are the various disasters which we are prone for. Second, we learned about how to prioritize any injuries in case of any disaster, like triage. We learned about the first three important thing, that is the first three coding: the red color coding, the yellow color, the green color coding, and the black color coding. Then we learned about the basic life support, how we do the CPR. Then we learned about the injuries management, and in the injury management we learned basically regarding how exactly to put a bandage, and how to stabilize a wound, how to stop a bleeding, how to manage a penetrating wound, and how to manage a spinal injury. So then we learned about transportation of the casualty. We learned about drowning in water, how to rescue him, how to give the first aid. We learned about fire, how to manage fire. Then we learned about very important, that is snake bite. Then the last one we learned about that is fits and convulsion. So I'll be stopping here. Now I'll open the for the this is open for the discussion. I will stop sharing the this part of the presentation. I'll be sharing my presentation to the convener of this training, and they will be sharing further these materials to you. So further, if you have a question, you can start asking me the questions.
How can we identify the epilepsy and fits, sir? Are they both are same or?
Okay, sir. This is very important to remember, sir. Both epilepsy and fits are same. Fits is a sign in case of an epilepsy. So generally, the convulsions can happen during even a heat wave also. So it may not be associated with the frothing in the mouth. The classic case of epilepsy will be having tonic-clonic movement. What is tonic-clonic movement? There is suddenly tightening of the whole body muscles followed by clonic movement. So that is in epilepsy. But in any convulsion which is related to fever, heat wave, or pregnancy related convulsion, there will be just jerk movement of the body. That is convulsions. For first
Okay.
aid for both are same, sir.
Thank you, sir. Thank you.
Okay.
Personally, I
Any,
am very grateful to you, sir. You have
yes, sir.
explained excellently. Wonderful session.
Thank you, sir. Thank you. Thank you.
Wonderful.
Mm.
Thank you, sir. Thank you.